How does lymph node biopsy help stage lymphoma? Imagine trying to solve a puzzle about how a disease has spread in the body. A lymph node biopsy is like taking a detailed piece of that puzzle to see what's really happening inside. When doctors suspect lymphoma, they often perform a biopsy on an enlarged or suspicious lymph node. This procedure involves removing a small tissue sample, usually about the size of a pea or a grain of rice, using a needle or minor surgery. The tissue is then examined under a microscope by a pathologist. This microscopic look confirms whether lymphoma cells are present and helps identify the specific type of lymphoma. Knowing the exact type is important because different types can grow and respond to treatment in different ways. The biopsy doesn't just tell us if lymphoma is there. It also provides vital details about how aggressive the disease might be. For example, some lymphomas grow quickly and need more intensive treatment, while others grow slowly. The pathologist looks at the architecture of the lymph node tissue and the characteristics of the lymphoma cells to gather this information. This helps doctors determine the stage of the disease, which is a way of describing how the lymphoma has spread. Staging ranges from early stages where only one lymph node region is involved, to advanced stages where multiple lymph nodes or other organs like the liver, lungs, or bone marrow are affected. While imaging tests such as computed tomography scans and positron emission tomography scans help locate affected lymph nodes and assess their size, they cannot definitively confirm the presence of lymphoma cells. That is where the biopsy becomes essential. It provides a microscopic confirmation that the abnormal tissue is indeed lymphoma and reveals details about its biological behavior. Combining the results from the biopsy with imaging findings gives a comprehensive picture of the disease. In essence, a lymph node biopsy helps stage lymphoma by confirming the diagnosis, identifying the specific subtype, and revealing how the disease has spread at a cellular level. This information guides doctors in choosing the most appropriate treatment plan. It also helps in predicting how the disease might progress and in monitoring response to therapy. Because each person's disease can be different, this detailed tissue analysis is a cornerstone of personalized medicine in lymphoma care. Always remember, discussing your results with a healthcare professional is key to understanding your specific situation and planning the best course of action.